Welcome to HealthCast, the heartbeat of health IT. I'm Alexander Bolova, production lead at GovCIO Media and Research. With me today is staff writer researcher Nikki Henderson. Hi, Nikki.
Hi there, Alex.
You had the opportunity to chat with Dr. Susan Gregurick, Director of the Office of Data Science Strategy at NIH. How'd it go?
It was amazing. We had a great conversation. I really enjoyed talking with her. And the thing is, this conversation, she had lots of exciting news to share, not only about the new National Institutes of Health Strategic Plan for 2023 through 2028, but also other initiatives that are underway at the agency. And at the beginning of our conversation, Susan highlighted the key objectives of the new strategic plan that mainly focus on helping researchers generate and disseminate data that is fair. She said they're also thinking about new opportunities for artificial intelligence and supporting a federated biomedical data research infrastructure. So Susan was also talking about the ways that the agency is promoting privacy and participant consent, which are a top priority for the new NIH director, Dr. Monica Bertagnolli. So NIH has also formed a partnership with the National Science Foundation and other agencies to launch a program next year designed to give more AI capabilities to researchers. So I have to say it's a really exciting time over at NIH right now.
Yeah, it sounds very exciting and very busy. A lot for you all to unpack in your conversation. Before we dive into your chat, NIH released its first strategic plan back in 2018. So what did Susan say were some of the key differences between the new plan and the old one?
Well, some of the key differences that Susan pointed out were there were a couple of things. She said that this plan zeroes in on the agency's data management sharing policy, with greater emphasis being put on common data elements and common standards, as well as more structured and fair data. She also said another top priority for this plan is, of course, AI. No surprise there. NIH plans to hire more candidates who are highly skilled in AI, and they also want to provide more hands-on AI training for the workforce they currently have in place.
Gotcha. So I know that there is so much in this strategic plan, but I just wanted to highlight biomedical research and data, especially in relation to our talks about AI. So in what ways will the new strategic plan help to enhance biomedical research and boost accessibility to high-value data sets?
Well, Alex, Susan talked about a major breakthrough on how researchers can now request genomics data in particular. The program is called the Database of Genotypes and Phenotypes, or dbGaP is what she called it. And the purpose of dbGaP is to record and disseminate data from multiple studies about the genotype and phenotype in humans. And the big deal here is that a data request used to take about 10 days or so. Well, with dbGaP, a data request now takes only about an hour. So that's incredible news for NIH. And so overall, it just will significantly increase the accessibility to data in a timelier manner.
Gotcha. Before we jump into your conversation, did Susan share any exciting news or talk about any future initiatives that she's really looking forward to? I mean, it sounds like there's a lot to look forward to, but anything in particular?
Yes, she certainly did. Susan was very excited about the recently launched Rapid Acceleration Diagnostics Tribal Data Repository. NIH released this back on December 1st, and it was established following the challenges of limited access to COVID-19 tests in underserved communities. So Susan said RADx is the first Indigenous sovereign data repository, which is fully supported according to Indigenous data principles. So it will really help address the impact of COVID-19 and other health disparities. But she also mentioned a really cool partnership between NIH and the National Science Foundation to launch the National Artificial Intelligence Research Resource, or NAIRR pilot in January. It will give investigators who are interested in AI different data sets and AI capabilities in a variety of areas, including healthcare, climate, and energy. And it'll make it possible to have a large scale AI model development. So she was very excited to tell me about that as well.
All right. Well, I'm excited to take a listen to your conversation. So let's not keep our listeners waiting. Let's dive into your interview.
Dr. Susan Gregurick is here with us today. She's the Associate Director for Data Science and Director of the Office of Data Science Strategy at the National Institutes of Health. And she will be talking about the new NIH strategic plan for 2023 to 2028. Now, this is really exciting news. Next week, the Office of Data Science Strategy is publishing a request for information, which will release a draft of the new plan to the public and then invite public comment for up to 3 months. Susan will also talk about the agency's current data initiatives, as well as data priorities for 2024 and beyond. Hi there, Susan. Thank you so much for joining us on HealthCast.
Hey, Nikki, it's great to be here. Thanks for the invitation. I'm super excited to talk to you today.
Wonderful. I really appreciate that. Well, Susan, we'll go ahead and dive into our discussion. For many years, a top priority for NIH has been to share scientific data. So, can you begin by highlighting some of the objectives of the 2023 to 2028 strategic plan and how will it accelerate the agency's mission of achieving better data sharing and management capabilities?
Thanks so much, Nikki. Well, you're absolutely right. With the release of our final NIH data sharing and data management policy, which was released on January 25th, I believe, of this past year, 2023, our plan and our goal is to change the culture of data sharing, to incentivize researchers to prospectively think about how they will manage and how they will share their research data by telling us when they write their applications for grants or for contracts or for other transactional authorities. This plan even is implemented within our NIH intramural research program. And through this plan, we hope that researchers will really think about how to make their data fair, findable, accessible, interoperable, and reusable, and share it for the greater use of all research. The 2023 to 2028 strategic plan for data science places great emphasis on this policy and on data sharing and data management. In fact, our very first goal 1, is to support and sustain the capabilities of this policy to help researchers generate and disseminate data that's fair and in a manner that will foster greater sharing and add value to our NIH research investments. Within this plan are ideas about effective strategies for cost sharing, looking at sustainability of data and data resources, looking at how to secure data and maintain privacy and accessibility, and to think about how we can support the biomedical data repositories and knowledge bases. Our second goal 2, really focuses on enhancing human-derived data for research. We're interested in supporting the acquisition and protection of data obtained from participants during the course of care, such as, for example, data derived from electronic healthcare records or other real-world data, including data captured outside of traditional healthcare settings. We want to promote privacy and also participant consent, and this is absolutely a priority of our new NIH director, Dr. Monica Bertinelli. These data are rich in biomedical context, and they paint a real holistic picture of human health during our course of care during our lifetimes. And so harnessing these data for biomedical research can truly unlock new advances in treatment and disease prevention. As not surprising, and it's on everybody's mind, is artificial intelligence. So goal 3 is thinking about new opportunities and new methods in artificial intelligence and computational biology. We want to harness the new innovations in, for example, large language models or foundational models to really build out on trustworthy AI approaches that would reduce bias and risk, that are also fair, that are validated, and that are explainable. We want to create opportunities for exploration of these technologies and new computing paradigms for biomedical research. And thinking about data and data infrastructure and AI, our fourth goal supports a federated biomedical data research infrastructure. We know that researchers have challenges in finding and in accessing and comparing data from the many different NIH-supported databases, including those that have data on health outcomes and risk factors. We have over 253 petabytes of data supported in over 80 different cloud-based data platforms. So connecting these data platforms is really a key to our strategic plan to drive new data science innovations. And finally, and the most important goal really is to strengthen a broader community of data science. We want to decrease disparities across institutions and regions and global partners in data science. We truly believe that everybody has something to contribute to data science, from the trainees who are just starting their careers to those who are advanced scientists who want to learn a little bit more about the latest capabilities in analysis and AI. We want to reach all investigators and establish ways to contribute to data science that's aligned with our mission and within our Office of Data Science Strategy. Thank you so much for noting that the strategic plan for data science will be released, I believe, on December 19th. And we hope that listeners will contribute to public comments through our request for information, and we'll make that public as soon as it is released.
Awesome. Thank you so much, Susan, for highlighting the objectives of the new plan. That is indeed very exciting. Well, NIH released its first strategic plan for data science in June of 2018. So I wanted to know, can you point out some of the differences as well as similarities between this strategic plan and the previous one?
Absolutely. And just a note of thanks to the many different colleagues at NIH. This is absolutely a group effort. All of our 27 institute centers and offices contributed language into the strategic plan, making sure that this strategic plan will resonate with every institute center and office's own strategic plan, because each IC, institute, center does release their own strategic plan. And it's truly been a joy working with, for example, the National Aging Institute as they are developing a strategic plan that aligns with this one. So I just want to, first of all, thank my colleagues who've contributed. There's so many ways that this strategic plan is truly an update and a really an advance that builds off of what we've done starting in 2018. And here's some examples about how they're updated or a little different. This strategic plan really does place the NIH data management sharing policy front and foremost. And it identifies unique challenges or opportunities, particularly for human-derived data. We've learned a lot since 2018, and for example, including social determinants of health or environmental determinants of health into an integrated view of data really provides a rich context for how we can understand human health. Just for example, if you include social determinants of health in your data models for risk prediction for cardiovascular disease in African Americans, it truly does improve the models of risk prediction. And this has been published, I believe, in 2019. So we are taking advantage of these new ideas. We're stressing common data elements and common standards because these capture data from healthcare settings in a structured way or from clinical studies in a structured way. So we really do want data to be structured, to be well used, and to be fair, including social determinants of health. And you will see not too long from now another request for information on ways in which we can improve and structure common data elements. Some of those ideas are consistency across NIH in using common data elements. We'll want the community to give us feedback on what will be a proposed set of core common data elements that we can all use together.
Oh, wow. Okay. And now when is that RFI coming?
I believe it's going to probably be in the early 2024, early to mid-January. We're working on it now, and we hope to have it released. Everybody has to touch it and look at it. So I'm really hoping that it will be released in early to mid-January. And you'll be able to view it from our website, the Office of Data Science Strategy, where many of the RFIs are linked or actually listed.
Okay, perfect. Thank you so much, Susan. Well, how will the new plan help advance biomedical research and improve accessibility to high value data sets and data reuse? And do you anticipate any challenges with the new plan?
The best thing about challenges is that there are always opportunities. So, and sometimes the hardest challenges are the best opportunities. So one of the hardest challenges that we've been working on really since I just started my role here in the Office of Data Science Strategy in September of 2019 was just getting researchers access to very many high value or high quality data sets that are controlled access data. This would be data sets that underlie genomics data, for example, or other types of participant data such as multiomics data, imaging, or even data derived from electronic healthcare records. Getting these data across many different institutes and centers is a challenge. And so we want to break down that barrier and that silo. I started this project with Patty Brennan. She's a close friend and was a dear colleague as the National Library of Medicine director. We worked to streamline and make consistent capabilities for data access across our NIH-supported data repositories. There are, as I said, over 80 of these. So I'm really pleased to tell you that in partnership with the Cancer Institute, the Heart, Lung, and Blood Institute, the Drug Abuse Institute, NIAAA, Alcoholic Institute, and Aging and Mental Health Institute, we have streamlined the way that researchers can request data, particularly genomics data. Now, this is all requested through dbGaP, so these are very much focused on dbGaP processes. But we've reduced the time that researchers can request that data. Typically, the average time for data request was about 10 days. Now, if you request a data set from any one of these institutes that are genomics data by dbGaP, the request time is less than an hour. So that's just one of the things that we've done and will continue to do that's built out on our new strategic plan for data science, because we really do want to create a fair, enabled data ecosystem that breaks down the barriers and promotes greater findability and accessibility of these data. We know that researchers struggle to get the data in a timely fashion, and it's our goal to really provide them with high quality data really within a day.
Wow, that is amazing. 10 days and now just an hour. That's awesome. That is
Yeah,
awesome.
I want to just call out the group that's been working on this, Mike Fiolo from dbGaP and Sue Chen from my office in particular, but all of the colleagues from the institutes play a significant role in really streamlining data access. And it was through the partnership with Patty Brennan from the Library of Medicine.
That's great to hear. Well, how does the new strategic plan address the integration of existing data management tools and the development of new ones?
So some of the things that we're doing is, for example, we want to develop data management core capabilities in across our data ecosystem. So strengthening the core data management competencies of researchers, data stewards, data librarians, and even our own NIH staff. So for researchers, we want to provide training on core data management sharing competencies. For librarians and stewards, promoting and enhancing fair data sharing at their institute. And then, of course, providing training and additional capabilities to improve our own ability to assess and understand the data management sharing plans that will be coming in from researchers. We also want to provide credit and incentives for data sharing. Just as an example, we've partnered with FASEB on the DataWorks prize challenge that awards prize money to researcher teams who tell us the best ways that they've enabled data sharing and data reuse. We'll be announcing our 2023 DataWorks Challenge prizes probably within a couple weeks, I'd say early 2024, and then there'll be an award ceremony in the spring of 2024. So early congratulations to those winners, and that's just one of the ways that we're promoting incentives and credit for data sharing. Of course, we want to develop metrics to measure data sharing and data reuse and its impact, and then tools that will assist researchers in the process of preparing, annotating, and sharing their data. That's just some of the things that you can look forward to with this new strategic plan.
Oh my gosh, that's great. giving the rewards, the incentives, and that's awesome. I know you mentioned earlier about AI, but what role will artificial intelligence and machine learning play in the new strategic plan when it comes to data structures, computation, and modeling?
Well, it's not going to be a surprise to anybody. We've all heard about the revolutionary technologies of generative AI. Maybe some of us have even used ChatGPT or Bard or DALL-E, among the many other online tools. And it's pretty exciting right now to be living in this world. But the application of these technologies in healthcare and research offers truly promising opportunities. For example, just to provide medical assistance to remote patients through AI-enabled medical devices, to assist doctors in reducing administrative burden, for example, in structured case reports, or promising new tools for researchers for breakthrough. Many people may not realize this, but NIH, we are the largest funder of biomedical and behavioral research. And we do have a mission that is focused on ethical AI research. So I'd love to tell you just a few things that we are looking forward to with the new strategic plan is to really focus on recruiting data scientists who are skilled in AI, to increase our hands-on training in these areas, to enhance our intramural computational environment to take advantage of AI. So we are looking at, and most likely we'll set up a secure cloud-enabled generative AI space. And of course, we want to enhance and increase the researchers who can participate in the AI field. This is through our Aim Ahead program, as well as the communities who can add value to the development of AI algorithms through Aim Ahead. So this is just some of the things that we're looking at to advance our work in artificial intelligence. And I can tell you that over the past 4 years, our funding for artificial intelligence has more than quadrupled. And that's before President Biden AI Bill of Rights and before the new executive order on artificial intelligence, which will absolutely push this forward quite a bit.
Wow. You weren't joking when you said this was exciting. I mean, this is a lot.
It is a lot.
Oh, wow.
I guess
Wonderful.
I should probably mention, because I know that it will be launched in January, that NIH is one of the partners with the lead agency, NSF, on the National AI Research Resource. So this will provide data sets and AI capabilities to researchers who are interested in artificial intelligence, not just in the healthcare and biomedical field, but in climate, in geological studies, in energy. So there's going to be quite a bit of resources for investigators. We, NIH, are partners with DOE on what's called NAIRR Secure. That's a secure computing environment for researchers to look at, for example, healthcare data or other DOE-related data. So the pilot will launch in January of 2024, and we're super pleased to be, a lead partner on what we call the NAIRR, National AI Research Resource.
Yes, and you said you're partnering with NIH is partnering with NSF,
DOE, NOAA, NASA, and I think other agencies are potentially coming in as well. So the National AI Research Resource will hopefully go from pilot to a full-fledged resource over the course of the next 2 years.
My gosh, this is amazing. I'm really looking forward to that. You'll have to revisit and give us an update.
I will, and I'd love to bring, if you have more than one person, I'd love to bring in some of the team from NIH's side, at least, to talk about what they've done. It's really a remarkable collaboration led by, for NIH's side, led by Laura Biven and Christine Cutlow, as well as a number of colleagues from the NCATS, NIBIB, NIAID, and NIMHD Minority Health. So the resources will be pretty extensive.
Yes, definitely. I would love to for you to bring them on with you. That would be great.
Yeah.
Well, Susan, does this new plan include additional language around fair data, trust repositories, and data management policies? And will there be additional work on open data and common data elements?
Absolutely. So, though it's funny when you speak to, for example, climate scientists who start to get into data, health data, and biomedical data, the first thing they tell us is, "Oh, your data is very diverse and it doesn't have just one format or one standard," and that's absolutely true. size and the diversity of data collected and stored in biomedical behavior research is extremely, extremely large, and it just continues to grow. So our goal is to, make these research data fair, and also to underscore the importance of the data repositories and knowledge bases which store and provide those data for researchers. So one of the things that we will be doing is to continue our strong support of data resources. We do have 2 funding announcements that are out on the streets to support both well-established databases and knowledge bases, as well as early databases and knowledge bases, asking these resources to comply with the fair and the trust principles to align with the OSTP desired characteristics for a data repository, and to think about ways in which they can not only store, share, and validate data, but also ways to think about findability across resources, metrics that can be shared across resources. One of the things that I'm super excited about that we launched on December 1st, so just 2 weeks ago, I guess now, 1 week ago, is the RADx Tribal Data Repository. It is the first indigenous sovereign data repository, which is fully supported according to indigenous data principles, the CARE principles. So those data will be managed and accessible through tribal data processes. And I'm super excited to explore the idea of how tribal peoples can manage and share data according to their principles and priorities. So I can't wait to see how this will continue as it rolls out.
Wow. Well, congratulations on that. That's wonderful. And you said it's called the RAD. What is it again? Can you?
Oh, sorry. Yeah, this this is a COVID program that during COVID we developed rapid accelerated diagnostics for testing for COVID. Well, during that COVID time, not only did we develop all these testing diagnostics, but we collected a lot of data about COVID, about the ways in which it affects people, how people are affected by long COVID, for example, how the testing devices work. We also collected a lot of COVID data from people. All that data is available to researchers. So that is one of the legacies of COVID, is that we have made all of that data publicly available to researchers through the RADx Data Hub. We also worked with tribal communities on the same ideas, testing data, how COVID affects populations in tribal communities. Those data are managed by the tribes through the RADx Tribal Data Repository. So they are in a different place, which will have indigenous data governance. Researchers can still request access to it, but they will go through the tribal communities to do so. So that's sort of the difference. But all this COVID data is available for researchers, and it's just a fabulously diverse set of COVID data that is available for the community to think about, not just about COVID, but just how does a pandemic, the scale of COVID, affect the U.S. population, and what can we learn from our response from it.
Oh, wow. Susan, this is just my next question is about future initiatives, but you have told me so many awesome things already about what you all are doing, what NIH is doing. And you said that particular pilot was launched December 1st. Is that right?
Yep. We put the announcement out on December 1st. And this is a strong partnership with the National Institute of Minority Health and Health Disparities, as well as our Tribal Health Research Office. So this is a joint partnership with 2 important key partners here at NIH.
Wow. Thank you so much for sharing that. Well, are there any future data initiatives at NIH that you're excited to talk about?
I do want to tell you a little bit more about the National AI Research Resource. We're contributing a high number and quality data sets, including image data, immunology data, cancer, and data on many different chronic diseases, as well as a very large set of COVID data collected through the National COVID Cohort Collaborative, the N3C, led by the NCATS Institute. And again, this is a partnership with DOE and NSF. DOE and NIH are co-leading on NSecure. That's really to provide data derived from, for example, healthcare records, clinical images, and other health data in a secure and trustworthy enclave. So we're also providing AI-enabled infrastructures through the NAIRR Open that's led by NSF, as well as other capabilities and training materials for large-scale AI model development. What we're excited about is that we truly do have expertise in interoperable data. We really do understand how to make health and biomedical data integrated through things like common data elements. I can tell you that the N3C, the data is harmonized to the OMOP model so that it is all comparable across the entire enclave. We're also really excited to think about new ways for AI compute through our data ecosystem. We are a member of the NAIRR Steering Committee. We help develop policies and programs and architectural principles for the NAIRR. And our priority in the NAIRR is to broaden the participation in data science, including enhancing trustworthy AI and aligning to the other principles of NAIRR that we hope that will connect to new communities and new resources. So that is something that is exciting. It's not in the new strategic plan for data science, but it is something that we will work together with many agencies to ensure that it's a successful pilot.
Oh, wow. And you said that's already been launched, or that will be launched in early next year?
It'll be launched early next year. And you'll want to look for that announcement led by NSF, but we'll certainly echo the announcement, as I will assume other agencies also will echo the announcement.
Awesome. Well, that is indeed very exciting news. And before we wrap up our conversation, Susan, I just wanted to know, I'll give you the opportunity for you to share any final comments or remarks with our listeners.
It's a really exciting time to be at NIH. Our new director, Dr. Monica Bertinelli, is truly committed to fair and equitable data science and artificial intelligence, among many other priorities. I work closely with her on ideas about health-related data science that really puts participant participation as a front goal and as a priority goal. That has been a goal of mine for years, and I'm so happy to work with her on her vision for data science, particularly in improving health and clinical data. So I think that the community writ large can really get behind Dr. Bertinelli and her new vision, not just for data science, but for NIH. And with that, I am so pleased to be here. I hope that you'll invite myself and maybe some of my colleagues to come and tell you about the progress and the work and the exciting outcomes that we've achieved.
Yes, I would love to have you back, and definitely your colleagues, especially after this project and NAIRR launches the pilot, and just to update us on other exciting things you're working on. So that would be wonderful. Well, it's just a pleasure talking with you, Susan. You just shared so much great information with us today. So I really, really do appreciate that. And I look forward to speaking with you again.
Thank you so much, Nikki. Me too.
Thank you, Nikki. That was a great chat with Susan. Before we let our listeners go, are there any last highlights or takeaways that you want to leave them with?
Well, I just want everyone to just realize, there really is a big push at NIH for improving the data sharing process and providing quick access to data and having just more fair data overall. So I believe that NIH will definitely be able to achieve their objectives with this new strategic plan. So that's really exciting. And another exciting thing is that NIH has a new director, Dr. Monica Bertinelli, whose priorities are aligned with the new strategic plan. So that's another big plus for them. And the agency has the new RADx Tribal Data Repository, the NAIRR project, NAIRR pilot that they're launching with NSF and NOAA and NASA as well in January. So it's really, really exciting all the way around. And Susan, get this, Susan said she would be more than happy to come back along with some of her colleagues and give an update on the NAIRR pilot and some of the other initiatives that they're working on. So I'm really looking forward to that.
Yeah, we always welcome our guests returning to give us updates and insights to what they're working on. So we look forward to having Dr. Susan Gregurick back. Nikki, thank you so much. Listeners can tune in 2 weeks for a brand new HealthCast. But until then, if you like what you heard, make sure you're subscribed. Please leave a review and a 5-star rating on the podcast platform of your choice. And hey, tell a friend. I think that a lot of you are going to be spending the holidays with friends and family. And what better gift to give them than the gift of knowledge of everything health IT? You can tell I clearly thought out that one in advance. Anyways, thank you all for listening. I'm Alexander Polova.
And I'm Nikki Henderson.
Thank you for listening. HealthCast, along with GovCast and Cybercast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them on your favorite podcast platform. And if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@govcio.com.